Tonight, advocates for those sickened by toxins from the massive debris of 9/11 are calling on President Trump to immediately reverse cuts he made to the World Trade Center health program. The reductions made last week were part of Elon Musk's so-called Department of Government Efficiency, or DOGE, which is cutting spending and eliminating jobs across the federal government. Anthony Gardner was the public affairs specialist at the World Trade Center health program before he was fired Saturday. He joins us tonight. Anthony, thank you for joining us. So about 20% of the staff was cut, I understand. What would the impact be on the 9/11 community?
Thank you for having me, John. Yes, in the days and weeks ahead, the impacts could be significant. So the clinics are operating where our responders and survivors get their care, but our program staff administers those contracts and those clinics and oversees and sets policy, approves certifications so that those 9/11 responders have access to quality and timely care. So if that program staff is not whole, our responders and survivors are going to start to encounter delays with getting access to care. And that could be life and death for some people because, let's say they're at the clinic and they get diagnosed with a stage 3 breast cancer. Well, the program team has to approve those cancer conditions in order to authorize that treatment.
We talked to the Department of Health and Human Services, which oversees the program, and this is what a spokesperson said in a statement. The clinical staff of the World Trade Center health program were not affected. Direct patient care is still functioning, and patients are still being seen by doctors and nurses at clinics.
Right. So the clinics are operated, they're contractors of the federal health program.
Right.
And so those are operating, but what's going to happen is in the weeks and months ahead, without the adequate program staff, those members who are seeking treatment at those clinics, say at Mount Sinai Clinic here in New York, they're going to start to get delays because there's not the program staff on the back end to approve and authorize their medical certifications.
Last question, bipartisan support for this. Were you surprised that this was cut?
Yes. The World Trade Center health program is congressionally mandated. If there's a government shutdown, our program operates and continues. And so I think we thought, given the sacred mission that we have to provide care and health care to our 9/11 heroes, that the program would be insulated from that. So I personally, as a 9/11 family member, my brother Harvey was killed on 9/11 and spent the last 2 decades plus working on a range of 9/11 issues, care very committed to this community, along with everybody who works at that program. This is not a job for these people. This is a calling. It is a mission. And we want to really just urge President Trump to take a closer look at this, reverse these cuts, make the program whole, protect it from further cuts as well.